For some time, in fact for many decades, most developing countries have relied on access to evaluation reports done by the World Bank, by various UN agencies, by the Japanese, and so on. While these reports have their own merit, as they are done by very professional organizations, they are not a substitute for evaluation of projects in the country, let's call it country X. So country X today should pay a lot of attention not to disposing of evaluation reports done by such important agencies, or call them development partners, but to establish its own M&E facility. The first reason for that is that these facilities are more capable than any foreign agency to incorporate and understand local culture and local practices, and take these more fully into account in doing their evaluation work, in gathering data, in discussing it with various authorities, and so on. The second reason is that once a local agency is established and off running, it becomes part of an integrated network of government organizations, and that will make it easier to flow the results of evaluation work done by the local agency to higher decision-making levels. And so, with these two reasons, it has become really compelling that we pay more attention and we take action to establish or strengthen, if they are already established, local M&E centers.
For us as local actors to actually see an impact with our work, we need to be able to do effective M&E. And to be able to do effective M&E, we need to have locally grown M&E components. And this is important simply because with us being the actors on the ground, we are the ones that are in touch directly with the beneficiaries. We are the ones that know the goals and objectives of what we're trying to achieve. And the use of local M&E officers allows us to actually see what is happening, to be able to do assessments as we go along, and to be able to do it not necessarily in a manner that our donors may want, but in a manner in which we are able to elicit direct benefits from, and able to elicit the type of data that is necessary and that our donors need. So locally grown M&E is a very important component. Some of us, like the Angie International Center, that deals with a population such as the violent disruptors in our women's situation room, requires that when these young people go ahead and make a switch on us, and they do that from time to time, you have to also be able, in your mindset, to be able to switch, reassess very quickly, and still move on and see how you can still get the data that's necessary for whatever you're doing. We also work with rural communities. And in rural communities, even though our M&E is the initial M&E will say, okay, we know that they don't read and they don't write, etc., but you may get into a rural community, and all of a sudden, the chief that you are dependent on to call together people to give you information or to assist you in getting information is not available, is ill, has gone somewhere, don't know when he's coming back, don't know how you're going to do it, and you're up against time constraints. If you have local M&E, you will then readjust yourself and not necessarily go according to whatever you send to the donor, but you will use whatever strategy you can get on the ground to achieve that same result. So the use of local M&E, the understanding of the time factor sometimes that's necessary to extend because of circumstances, and the fact that the adaptability and flexibility given to the local actors will make whatever that comes out much better and a better impact survey.
A live laboratory as a mechanism to build local capacities to take ownership in monitoring and evaluation, and which has been implemented here at the Angie International Center in Monrovia, Liberia, has been an opportunity for us as local actors to tackle challenges in M&E methodologies by our international partners. This is simply because such international methodologies are always underscored by a core element of universality when it comes to its implementation. Here in Liberia or elsewhere in the world, actors in the peace work are not a homogeneous group, so the same set of methodologies cannot be applied to them when it comes to monitoring and evaluation. The live laboratory therefore builds local capacities with M&E tools by allowing certain flexibilities that still guarantees the best out of result frameworks.
In Egypt's case, I was the founding director of Egypt's National Center for Monitoring and Evaluation, which is called PIMA, in 2003. And during my involvement of 7 years, I consider these 7 years as having lived in a living laboratory. Because you have to remember that we were going into uncharted territory. There were all kinds of references and so on, but in terms of practice on the ground, we really had to start it from ground zero. And this has its own challenges. But let me just step back and say, how did that center get established? Of course, it takes a bold decision full of risks by high-level government officials, in this case the Minister of International Development, who had the vision to say, let us take action to establish Egypt's National Monitoring and Evaluation Center. That decision was taken, and following that, we had to do a lot of work in visualizing what such a center should look like, how should it operate, what are its priorities. So there was a fair amount of discussion. It's one thing to make a decision to establish a national agency on monitoring and evaluation. It's another to work out the technical and administrative details which are necessary for its functioning. One of the things we were careful not to do is to spread our resources, which were very limited, to spread them thin over the whole range of activities that an M&E center could conceivably take up. So, one of the interesting things, having established a mandate and priorities, was what kind of relationship should that center have with its higher level government to which it necessarily reports. I cannot exaggerate the importance of the professional autonomy of any local center building activity, because you will have to understand that being established and funded by government, at least for the first few years, the stakeholders will have, if not a sense of suspicion, but an assumption that the center, when the chips are down, is going to have to rush to the defense of government. But giving professional autonomy that has given us substantial leeway in doing our work without being apprehensive about or trying to accommodate political pressures of any kind.
The experiences from the Live Laboratory can amazingly be described as being representative and constitutive of a condition where local partners establish leadership over development strategies, policies, and actions. As a peace worker in a post-conflict country, for me, a shift in ownership in monitoring and evaluation to local partners shows a genuine credibility towards an international development corporation that establishes strategies that foster local ownership into projects from the start. It is also an embodiment of a practice that is devoid of systemic privileges, biases, and inequalities between local and international actors when it comes to project implementation in developing countries.
We certainly had changes due to the pandemic, and the changes that we found was the manner in which the restrictions, and not only the restrictions that is the health restriction, but also the restrictions that government put into places. The restrictions, first of all, that you had to wear masks, the social distancing, all of those type of restrictions that came with the healthcare workers and with the health issues had to be abided by. And we found that to be problematic for us. The government of Liberia also, of course, put into restrictions. Our borders were closed. People were home and not at work. So all of that, the social distancing, the masks, the roads, our roads, because it's rainy season, the roads became impassable. People were not out there to see about them because of the shutdown that we had. So we found ourselves, especially those of us who were actually implementing projects during this period, found ourselves at a point of we have to redo this, we have to rethink this, how are we going to go about it? And we had to think about innovation. We had hope that we'll be able to do things like Skype or Zoom and these other applications that you use, but that is only if internet is available. Remembering that in Liberia, in our Liberian context, our internet is not available throughout Liberia, and our projects are not in the capital city, Monrovia. They're out in the counties, in the rural areas that do not have stable internet. So Skype and Zoom isn't going to work for us. Not our preference, of course, is face-to-face contact. There's nothing like that. But interviews, our second option would have been Skype or Zoom or one of those applications, and that was not available. So we had to rethink. And what we did is we went just one step down, but yet innovative enough. We went to the radio and we did our talking parts using the radio. We were able to get the communities involved using the adaptability of the radio under the corona restrictions. And that way people were able to not only listen to what was going on in terms of what our presenters gave, but they were also able to call in and participate. So that was an adaptation that was necessary and the flexibility that was necessary, and we had donors' confidence to do it. One of the things that I think donors need to look at, especially in terms of pandemics and things like this, is that the timelines should not be too restrictive, as things take more time when you have pandemics, when you no longer have the assets that you had before, and to allow us to innovate to achieve the collection of data that we really need. So those are things that are very important when you're looking at the pandemic.
Look, for example, at international development agencies such as the World Bank, USAID, DFID, UN agencies, among many others. They have not failed to take advantage of the opportunities which technological advances have provided. So they have looked at what they do and how they do it. The bottom line was not to update themselves on technology per se, but to use the benefits of these ICT advances to do a better job more effectively and to do it more efficiently as well. If we're able to use them effectively, then we reap benefits including lower costs per unit of response, speed of transmission and of processing and analysis of data, and speed of submitting the results for our monitoring and evaluation work to decision-making authorities to incorporate in their decisions relating to future development projects. So these are undeniable advantages. Now, on the opposite side, let us take a look at our data gathering methods. They include primarily survey questionnaires, interviews, focus groups, not to mention observation method, content analysis, and so on. When we had the opportunity for a face-to-face dialogue with our potential respondents, there was no limit to the scope of the questions, of course within the parameters of not losing the attention of our respondents. And we could capture not only words, but capture body language and other data that we think is useful in putting together a package of responses that lead to valid conclusions. Today, of course, we have to revisit our questionnaires, take another look at the questions we have. As long as these questions invite quantifiable responses, there's no problem. We sometimes also use scaling techniques in order to convert responses into something numerical. But there are questions which we deem are important that are open in nature. It is not yes and no, it is not choose from 1, 2, or 3 options. It is open, and they're deliberately open because they would like to obtain from the respondent better understanding of what he or she means by a quick answer. We also lose the option of probing, which is important again in validating questions, in making sure that we have not misunderstood a given response, and so on. So these are limitations which current technology has yet to provide a satisfactory solution to. The same really applies to interviews and to focus groups. Now, what do we do about remote villages and parts of any given country that is trying to do monitoring and evaluation of its project in these areas? The difficulty of communication, physical, because of lack of transport facilities perhaps, good roads and so on, or the lack of internet access and the fact that many of these remote areas have inhabitants with very limited purchasing power that may not be able to acquire the equipment necessary to transmit remotely. So here what we need to do is to decentralize our monitoring and evaluation work in these areas by forming alliances or partnerships with locally based institutions, whether they are NGOs or other types of organizations that would be willing to help. Now, this requires that we work very closely with them, train them online as to what monitoring and evaluation is all about, and support their preliminary explorations to access our target respondents in their communities.
Here in Liberia and elsewhere, it is now the commonest knowledge in 2020 that the coronavirus pandemic has changed the way we do in-person engagement in a manner that is unprecedented like any other. The best practices and lessons learned during the live laboratory sessions in monitoring and evaluation was the opportunity for me to align international priorities with our local realities in our M&E methodologies. And a take-home idea for me is the fact that by encouraging local ownership of the process, you ensure a continuation because local partners remain responsible for the day-to-day operations, sometimes even in the face of a pandemic.
What is going to happen if and when we overcome the current pandemic? Whether this is going to take 1 or 2 years or even 5 years. We are not going to throw away the benefits we will have gained by using the advances of technology through cost reduction and so on. But we have an open window through which we regain traditional face-to-face and direct contact with our beneficiaries and stakeholders. So the key question is, for any given task in monitoring and evaluation, we would have to weigh the advantages and disadvantages of each of these two options. In many cases, continuing to use technological advances in digital data collection would remain the same and indeed would be strengthened. In others, we would have to rely back on the traditional methods of face-to-face. And for me, look forward to having access again to traditional methods, because there is yet no substitute for human interaction.
The innovation at the Angie International Center is that our support for local partners to take lead in their monitoring and evaluation at the institutional level has automatically translated into individual ownership, what we call our local champions, and they represent our officers in the communities, in the counties, and in the districts where we have active projects. By this, we have been able to use proxy tools to remotely deliver monitoring and evaluation as we even mobilize and empower community actors to continue this process. In order to fully appreciate this mechanism, it is important for me to inform you that here in Liberia, 6 months of the year, we are immersed in heavy downpours, which causes upward mobility to counties and districts and communities where we have projects. So this challenge coupled with the restrictions on movement during this period of coronavirus, could have heavily and negatively impacted our monitoring and evaluation. But for our leadership on local ownership of the process, we have been able to mitigate any delays at this period. So trust as a concept is a foundational principle for a successful monitoring and evaluation, as a relationship of trust is a prerequisite for an effective monitoring and evaluation. In a post-conflict country like Liberia, you realize that trust does not just happen in a vacuum when it comes to peace work, and especially when your core target audience includes former child soldiers, former members of militia groups, current armed robbers, and sex workers. In this manner, trust becomes a much more bigger process, which is initiated at the commencement of the project implementation, and which you have to nurture so that it will later feed into your monitoring and evaluation processes. For example, by character, these people are used to being used and dumped by other people for one reason or the other, to cause election violence, to cause chaos in their communities, for any number of reasons for their sponsors. So they walk around with the mentality that everybody is there to take a piece of them and dispose of them as garbage. And so that is why they are always the hard to reach target when it comes to data collection in monitoring and evaluation. So, for my work here at the Angie International Center, trust in monitoring and evaluation, which encourages the active participation of my core target audience, takes inclusive planning, time, and effort. My responsibility is to create a level of trust at all times to establish an open dialogue with my core constituents. In Liberia, working with the gang youth, other disenfranchised and disadvantaged youth in slums and ghettos, one key lesson I have learned is that I always have to meet them at their level of convenience. That is, I first of all need to let them know that I trust them, which then generates a reciprocal relationship strong enough for them to trust me with their information. So a practical example of this is that I always meet with the gangs in their ghettos, in their slums, and also in their bases. And I never meet them in the office or at any public place. And the reason why at ABIC we don't take these people from their places of convenience has to do with the fact that it is to ensure they are comfortable with the process at all times. And in our experience, it has even impacted how we collect data, because at the end of the day, it is not just about extracting information from them, but being able to be in a safe space and being able to provide feedback that empowers and continues to build the relationship of trust between ABIC as an organization and also our target audience.
Trust has become a very valuable component in an institution's viability. I distinguish 4 dimensions of trust building. The first is between the M&E Center and the supervising government authority, in Egypt's case, the Minister of International Cooperation. How did we trust? How did we build mutual trust? To start with, there was a series of meetings between the minister and myself in which we explored various aspects of M&E Center. How do they succeed? How they might fail? And the question of trust came up. The conversations with the minister, which took place over a few months, 3 months, discussed all kinds of things about the center, what the center should do, what should not do, And I responded to the minister's questions as candidly as I could. And at the same time, the minister responded to questions which I raised in order to know precisely what I'm getting myself into. These conversations, while for some people might appear to be too long, were actually an initial investment in trust building, without which we would have met difficulties. The second dimension of trust building is within the center itself. How we did that? Through very careful recruitment. We were looking for young graduates who not only scored high academically, but who showed potential commitment to the cause of the M&E Center. They were just not going to get a job because they could have got a job anywhere, given in mind their academic credentials. This was step number one, careful recruitment. Secondly, we decided not to go to the field until the recruits went through a very intensive and rigorous 6-month training workshop in which I participated, but we made it more participative. I did not want to appear that I was giving lectures. I had a role to play, but I wanted them to start playing their role as professionals, not afraid to make mistakes while experimenting with various ideas. So that's within the institution. And that kind of trust building strengthened as we went into the field and started together to meet some of the challenges. The third dimension of trust building is between the center staff and donor agencies. We had to rely on these. They were home-based. Rely on these in order to get necessary documentation for our M&E work, and indeed to request interviews with them as their role, what they see as going well and not so well. I recall the first time was a meeting with the NIDA, the Danish agency. We were courteously met, and they furnished the documentation for the project which they had funded. And it was not until we started delivering our first evaluation report that we went and visited them again, and they were pleasantly surprised because we were not a known entity at that time. So the representative of the NIDA at that time, having made some very interesting comments, admitted that his initial reactions were one not of suspicion, but was a sense of hesitation not to know who we were, except that we were government-sponsored, and there's an implicit assumption that our agency was there when the chips are down to defend government actions. He was convinced because we started making critical comments about the NIDA, about our own government, as well as about some of the things we saw in project management. So we conveyed a message that we are professionals and that even though we are part of a Ministry of International Cooperation, that we had sufficient autonomy to say it as we see it, as the saying goes. This has continued to be our approach, and we earned the respect of our respondents, our development partners, and in the process also of the minister. The fourth dimension is between the center and beneficiaries and other stakeholders. Of course, this is of primary concern. So how did we do that? We made sure that we conduct ourselves according to the code of ethics we had agreed to. Integrity, transparency, respect of privacy and confidentiality, acceptance that sometimes our respondent would reject answering some questions. And the second thing we did was to share draft evaluation report with our key beneficiaries and other stakeholders and invite them to do a critique of these. And we took these criticisms very seriously. We amended our draft to take into account points that we believed had merit and before we finalized the report. So this kind of communication, open communication between center staff, myself included, and our various stakeholders were an important building foundation for mutual trust. Now, it doesn't mean that everything went smoothly. There were tough situations sometimes when beneficiaries rejected most of our recommendations, and we had to invite them to a meeting in order to explain what we have done and why, and to listen to their side of the story. Our most important weapon in responding to these, what we called unjustified criticism, was that our work was evidence-based. I repeat this term, it is absolutely critical for any M&E center, anywhere, evidence-based. This was our support, which when we presented to those who had rejected our recommendations, made them rethink their position. Let me conclude by saying trust building is not a one-way street. It's a two-way street. That's why I prefer to talk about mutual trust building. And it is not a question of statements of intent or best wishes. While these are welcome, what really matters is that each side of the trust building formula would take deeds, actions, consistent with the pledges they have made.
How do we build trust for more efficient and effective monitoring and evaluation is a question that goes to the core of M&E. When you are doing M&E, you have to realize first that trust is really fragile and fluid. It requires mutual respect. Trust is a very important component when you are implementing projects, especially with vulnerable populations. The vulnerable populations already don't trust adults and do even trust institutions even less than that. So the building of trust is tenuous at best and takes time. We must remember that trust can be lost in a blink of an eye depending on the situation, depending on what is happening at certain times. The population that we work with, that is the vulnerable, that is the violent disruptors, and even our rural population that not necessarily violent disruptors, but just have a distrust of government or distrust of people coming from the capital. So they're very cautious in how much they would trust you with their information. What do you want to do with it? How do you want to use it? Those type of things. So you have to have transparency in these things. You have to be able to understand that at some point they may trust you, and then at another point they may have to reevaluate whether they should continue to trust you, whether it's based on your actions or something that happened on the ground that changed the whole concept, the whole concept of what was going on at the time, or the context has changed all of a sudden, and you have to have that adaptability to be able to engender that trust again. So just saying that trust is essential. It's essential because you have to build on trust as you go. And the more you build on it, the better it is for your project, the better it is in implementation, the more effective it is. M&E professionals in developing countries support the localization of M&E by training our staff in M&E, and that way they can see the total impact of the project. Once trained, the staff will then have the ability to contribute to the assessment of the project. And should circumstances intervene during the implementation of the project that necessitates some modification of the M&E plan, the staff will then be able to provide insights during the strategy sessions. This will result in more impactful projects.
As professionals in developing countries, you realize that monitoring and evaluation varies, especially in a post-conflict country like Liberia. But I would say the support we can give to the localization of monitoring and evaluation has to do with the fact that we need to build strong teams with clear information management systems and also a competent staff with a strong program design understanding. This will ensure that the capacity of local actors is well developed before we ask for and lead monitoring and evaluation roles from our development partners. At the institutional level, this includes ensuring that local actors and organizations have a checklist of top priorities to improve in their M&E processes, that there is also frequency of staff training and other capacity building activities in their monitoring and evaluation methodologies as they learn new tools that best suit their local context. It is also important that a percentage of the organization's budget is dedicated towards monitoring and evaluation activities. There is also the need to use new tools to collect data, to analyze data, to store data, and most importantly, that we do quality data checks at all times during our monitoring and evaluation. For our international development partners, their primary role will be to provide the necessary financial and logistical support towards a localized ownership of monitoring and evaluation as we continue to execute projects together.
Our international development partners can facilitate this process in adaptation to more local ownership by diverting more professional M&E responsibilities and the funding toward it to national and local actors.
And I'd like to discuss it against the broader perspective of development cooperation. As we know, development cooperation is a two-sided coin. There is the recipient side and there is the development partner side. And it is a joint responsibility. I'd like to come back to the notion of joint responsibility in a few minutes. But right now, let me look at it from the point of view of recipient countries. Recipient countries should consider a number of points, and I'm going to mention only three. One, we need to take more seriously our ownership responsibility for project design. What does that mean? It means that projects need to be based on a proper needs assessment. It means that we have to have clearly defined goals, and that these goals are realistic and achievable in light of whatever resources are allocated to it. Next, there is room to improve our implementation practices and capabilities. How do we improve on that? First, we need to make sure that we recruit professionally and technically and managerially qualified project staff. After all, they are in charge of implementation. They have to have the skills and the abilities and the know-how to run these projects. They also need to have assurances from their political superiors that there shall be no interference in project implementation to seek political goals. And thirdly, we need to improve and strengthen the accountability mechanism, which would ensure that project resources are used properly and effectively. What I am stressing is that it is important that we speed up the honoring of our commitments along the lines agreed. Let me now turn to our development partners. My key message here is that while progress has been made, substantially in some cases, we would like to see our development partners move away from the conventional partner or donor recipient model to one of a genuine partnership model. Again, what does that genuine ownership or genuine partnership mean? It means, among other things, that our development partners have got to respect recipient countries' goals and working practices, and that they need also to provide more space, more room, if you like, for recipient countries to exercise more fully the rights and responsibilities of project ownership. Second point is that we need to, if we are serious about genuine partnership, to remove whatever is left of conditionalities. Again, a lot of progress has been made by development partners, but we need to replace them with a joint monitoring and evaluation mechanism whereby both sides sit around the same table and consider what works and what does not work. And in light of their joint conclusions, then each side would take actions to improve the performance of the project under review. Thirdly, we need to strengthen further mutual accountability. By that, of course, we are referring to the commitments and pledges made in many conferences and workshops, including the Busan Accord and the predecessor of the OECD Working Party on aid effectiveness, where there was no shortage of statements confirming the importance and the necessity of enforcing mutual accountability. So it is only when we consider the broader issues that I have briefly referred to that the question of improving our monitoring and evaluation practices come to mind. What is good about improving M&E practices if project designs are faulty, if implementation is full of malpractices, if our development partners still insist, or some of them insist, on the donor-recipient model. So I am optimistic that we have the ability and hopefully the willingness to accelerate the significant progress we have made on all fronts. And there's no better time to accelerate that progress than now, where we are suffering from the impact of the current pandemic.